Downtown Boonville has a number of amenities, businesses, conveniences. Not bad for a tiny town in a small county. But if you need one, you won't find a hospital here. Not for miles and miles.
He said, I know I'm having a heart attack. And he did have a heart attack, but we took him in our own vehicle. 2 hours.
2 hours for Brenda Sizemore's husband to be treated closer to his heart doctor in Lexington. It's the terrifying reality for this family who lives in the rural community of Ricetown. What's so hard about finding health care out here?
We don't have any. I mean, we have a few primary doctors and no specialist.
Sizemore asked not to be on camera, but she says that worry and her husband's pain keep them up at night.
He can't sleep.
Multiple heart attacks, cancer, not knowing what to do or where to go if something happens.
If you're sick, and there's nothing around, you just have to turn to the whatever's out there.
A WKYT Investigates analysis found that several communities in Owsley County have among the longest drives in the state to get to a hospital. Even from Boonville proper, 35 minutes to the closest one, a small hospital in Jackson, 48 minutes to Manchester, 52 minutes to Irvin, 57 minutes to London, 58 minutes to Hazard. Anywhere else, over an hour, when mere minutes can matter.
Mean different life or death, or being crippled for the rest of your life, or really make a big impact on the quality of your life if you survive it.
County leaders say the lack of access, along with other factors, clearly hurts the health of folks living here. Owsley County has had the lowest average life expectancy of any county in Kentucky.
It's very concerning. I mean, these are people I know and love.
It's a tough subject for Judge Executive Cale Turner to talk about. Serving his 4th term in office, seeing cancer, drug addiction, poverty take far too many too early. Owsley County has been considered medically underserved for decades. It first got that designation in 1978. So the health gap here isn't just a passing trend, it's generational. Still, sadly, Owsley County isn't the only one. It's one of 43 Kentucky counties without its own hospital. Nearly half of those are in Appalachia.
One of the reasons that this area has had such health disparities is because it's been largely forgotten. And I think that we need to work back towards bringing the area into the public focus.
Experts say these communities continue to deal with a perfect storm, higher risk and less access to care. All of Kentucky's Appalachian counties have lower life expectancies than the national average, and most are even below the state's average.
We don't have mass transit. Interstate highway systems don't often go into these areas, and so people just are, turn out to be isolated.
Judge Turner hopes the completed final stretch of Kentucky 30 will help, providing a shorter and much straighter route to London.
You're going to have a lot more specialists available once you get to London. You still got a little farther distance to travel than we would hope for, but that's going to be a big improvement.
But it's little solace or even convenience for folks out here in rural Ricetown. Isolated, but far from alone, several of them making long drives daily to meet specialists or for treatments.
Right now, I know of 4 friends and neighbors that are dealing with the same thing, and they're going back and forth.
Sizemore even says they found in some cases it can be quicker to drive these windy roads themselves in an emergency than to wait on an ambulance to reach them and take them back out. A risk, yes.
You just take a chance.
But she's come to realize the twists and turns and so much of life out here, just out of their hands.